Thank you very much to all of you for coming to this interdisciplinary conversation between the artist Gideon Rubin and the maxillofacial surgeon Roman Hossein Khonsari here at Galerie Karsten Greve in Paris on the occasion of Gideon's exhibition A Stranger's Hand. You will certainly wonder why juxtaposing these two worlds that seem so far from each other. Well, to me it was quite obvious actually to create this encounter between these two worlds that are very far from each other, but looking at them closer, there are more things in common that we can imagine. Maybe it's just important at the beginning to explain a little bit what is maxillofacial surgery. And Hossein, you will do it in a few moments more in detail. Just to explain you really briefly, it's a medical discipline that aims to restore faces of those who have lost it either by an accident or due to a disease, or who are born with abnormal features. It is also interesting to recall actually that from the 12th to the 18th century, the work of a surgeon was associated to the profession of the barber surgeon. And so this profession was actually considered to be a public art, and the surgeon, the barber surgeon, was considered as a craftsman of the body. I really like this kind of reference of craftsmanship and art because to me, Gideon and Hossein both are craftsmen of faceless memories. They both work, well, either the one is working with a brush, the other one with a scalpel, but both are reconstructing identities and memories of deleted faces. And one on his paintings that we see here, and the other one in his daily practice. The current show is called A Stranger's Hand. So today it's going to be, it's Hossein, Dr. Khonsari, the stranger, who is going to take control on Gideon's paintings of faceless portraits, and who is going to show us Gideon's artistic universe in a different perspective through his approach of a scientist of humanities, and we certainly will discover corners that we haven't seen before. So before starting this discussion, I just wanted to say that the last 10 minutes of this talk will be reserved to your questions. So please do not hesitate to ask at the end, Hossein and Gideon, your questions. So Gideon, I start first with you. Gideon, we're here now at Galerie Karsten Greve, surrounded by your latest paintings. Your exhibition is called A Stranger's Hand. But let's have a look back to the beginning of your career. How come you became an artist, and the fact that you're the grandson of Rubin, the famous Israeli painter, did this influence your decision?
Well, I actually didn't plan on becoming an artist. It wasn't in my plans, and it happened as a surprise, a very pleasant one, when I was traveling after I released from the military service in Israel at the age of 22. I started traveling, backpacking in South America, and on a salt desert between Ecuador, Peru, and Bolivia, a friend handed a brush, and that's where I painted. And I felt, looking back, I can always say it took years to understand that, but it felt, for the first time in my life, it felt like I've done something right, really right for me. So that started the process, and I find that I'm still traveling, I'm still going around, and I'm still painting.
And you make us also travel with your paintings. So Hossein, you are the maxillofacial surgeon. You work at Hôpital Necker, the children's hospital in Paris. You also direct the craniofacial growth and form laboratory, and you coordinate also the implementation of 3D printing of les assistances publiques hôpitaux de Paris. Exactly. Could you just tell us why did you choose maxillofacial surgery as your surgery domain, and also what is exactly maxillofacial surgery? Could you explain it a little bit more?
So thank you, Anahita, for organizing this talk, and thanks to the gallery for giving us some time to discuss. The reason why I chose maxillofacial surgery, it's always very complicated. When we go into medicine, we don't really know, generally students don't know what field they're going to end up in. And we realize with time during the surgical training or medical training that we have some personal affinity with a given organ, and it's quite mysterious. So some people have a personal relationship with the liver, some others have a personal relationship with the heart. So I was more into the facial and the facial skeleton issues, and I really don't know why. But that was what was appealing me in the medical field. And also, during your training, you also meet people for which you have lots of admiration. And it also, I think it determines a lot the specialty you end up in. Maybe I'm going to remove my glasses.
I wanted to tell you, but I didn't dare.
So it determines a lot the field you'll end up working in. So maxillofacial surgery is the field that's dedicated to the reconstruction of faces. And we deal with patients who have inborn diseases, who are born with abnormal faces, patients who have quite aggressive surgical procedures, for instance, for cancers, and in whom we need to remove one part of the face and then reconstruct it. For instance, cancers of the jaws that require quite destructive surgical procedures to remove all the tumor and then imply that we have to reconstruct the missing parts. And also we deal with trauma, of course, of course in the Paris region, most of the trauma comes from traffic accidents, but in other regions it's war accidents and injuries. So basically it's also reconstructing missing parts in people who have been deprived of one part of their face. So to make things more clear, I've brought you some examples of what we do. For instance, Anahita mentioned that I'm into 3D printing. This is the 3D printed skull of a kid with, of course it's a smaller size, I don't know if you can see it, but of quite severe craniofacial malformation. So you can see that the whole skull is abnormal, all the shape, all the architecture is abnormal, and our job will be to reconstruct it step by step and to go towards a normal face. And otherwise for accidents, I will show you some examples later, but we can start with one quick image which is here. I'm sorry if it's a bit rough, but this is a very famous example of maxillofacial surgery. It was really a big landmark in our field. In 2005, in Amiens, in the north of France, Professor de Vauchel, who is one of the major practitioners of my field, did the first face transplant. So on the left-hand side, you see the patient before the injury. In the middle is the patient injured, and we had no surgical solution, traditional surgical solution for her. And on the left part is the patient after the transplant. So you can see her with her new face, and it's the face of someone else. So obviously, I work in this field, and this raises lots of questions that have interactions with the work of Gideon. Like the creation of new faces, where is the memory in the face? Where is it located? Is it located in other parts of the body? And what happens when you erase the face of someone and you reconstruct it using either other pieces of the body or literally the face of someone else?
So actually, what we see, this kind of erasure of facial features are caused by traumatizing events. That's what you were mentioning, Hossein. And this makes me think of you, actually, Gidi, as well. There was this big traumatizing event also in your life that caused a real rupture and in your artistic expression as well, and was a real turning point, which was 9/11. Could you tell us a little bit more about that?
I mean, so it's actually picking up from where I started, traveling and started studying, and I'm learning to paint, and I'm living in New York, and I'm doing my BA, and I go to what I love when I look in museums. So I wanted to paint from life. I wanted to learn about painting. I didn't know anything. Although I came from a family of painters, I didn't have any knowledge, literal knowledge. So that's what my first couple of years, I was painting from life with every detail inside and enjoying to learning what paint does, etc., etc. Then I came to London to study my MA, and between the 2 years, so the first year of the 2 years studying in London, I paint these, kind of paintings from observation, long self-portraits, conveniently because I was always there. So I mean, these took months to finish, and there was every detail in them, etc., including all the facial features. And then, regretfully, I found myself in New York in September 11. I went back to New York, and I was a first witness like many other people. And when I came back to London, I just could not paint like I did before. It was just, I think I had to unload so much stuff that was in me and boiling in me, and to look at oneself in the mirror for 3 months, I couldn't do it for 3 minutes. So it was just like a guillotine for the old work. It was gone. And then I think at the time I was in Europe. I was looking a lot about painters like Morandi, for example, and the kind of little still lifes and immediate quick paintings. And what I wanted to do was just make, instead of one painting every 3 months, make 3 paintings a day. And I think that was fitting more to my character. So this trauma actually kind of brought me into a way of working which is more me somehow. So as I paint these toys, I'm always into the past. I'm looking at the past. I'm looking at memory and history. And I'm painting these old little kind of abandoned toys. And I think what was appealed to me at the end was the kind of lost life or this hidden life. Almost like would you find when something horrible happens and you have little, well, parts of dolls, there's other parts that we know. And what was very crucial for me was this kind of way of how these objects transfer these stories, these lives that was handled and handed to them as they went along until I held them. And as I'm painting it, I'm painting very quickly, and I'm painting these dolls and toys that are missing certain parts. But I'm always a portrait painter, and slowly I shift back to painting portraits. At the time, it was people close to me, but I'm using the same ways of painting as the toys, so no longer this kind of old way of painting and really considerate and slow, but very quick. And I could see that I could describe what I need, not necessarily with everything. It's the same way that the doll was missing a hand or an eye. I'm painting the girlfriend at the time, and I'm just doing a shadow for the eye. But I know who she is in the painting, and everyone looking at the painting know exactly who it is. So I think that kind of got me going, got me this, just to end. And then a couple of years later, I always was looking to work with photographs. I stumbled upon an old antique bookshop in Hampstead, and then I found some old photographs. And old photographs, they're kind of yellow and the details are lost. So that all kind of connected, and it became this kind of recognized style that people recognize with me now.
You're talking about the lost lives. You were just mentioning it, and I'm thinking about something that you said in an interview some years ago. There's also the fact that part of your family perished in the Holocaust. That actually. There was no documentation left, actually. They lost everything, and you lost also a lot from your family members. So the fact collecting old photographs and recreating them on your paintings is somehow an urge to reclaim a lost past in a way. And actually here we are again with this traumatizing event, Holocaust, that caused also, or that influenced in a way also your artistic expression, or the way you do it, actually, So the people in these photographs, they don't exist anymore, of course, but you recreate in a way a subjective vision of memory in a way on your paintings.
It's as if, like you said, it's like a reclaiming a lost past, but in some way, I mean, they mostly don't exist because these are very old photographs. Probably some of the people have passed away. And then but then it's also anonymous people to me. But what happens, and that's, I think, a point that when we had a chat before, that I was interested, obviously, in Hossein's practice, was even though they're faceless, I find that they have to be created, they have to have a life, they have to have a convincing entity, they have to have a life within this painting, within this space of the painting. And the fact that they don't have a life doesn't mean they don't need to have a life. No, sorry, don't have a face doesn't mean you don't have a life. And I find sometimes it's almost like a wind going on a rock or sand or water, and it's kind of like you slide things and you move them and you move, and maybe what's left is just some core that then can be transferred and being pulled from a very distant time to my time, and I think then it's when I'm getting interested in it a lot, I find.
We're talking actually about the creative process, Hossein. There are parallels with your practice as well. Creativity, subjectivity, to reconstruct these deleted faces.
Yeah, this is always a problematic question for surgeons because we don't feel very creative in our work when we perform it. We follow many rules. So, for instance, when you want to reconstruct a face, there are some general rules of how a face should be regarding its architecture, its balance. For instance, if you have someone who has lost his lower jaw, based on his upper jaw, the rest of his skull, his dentition, you have quite a good statistical image of what his missing parts have to be. So that's what we base on our work on. So our creative input is quite limited. And the other thing that's really important that relates to Gideon's work is that we realize, and it's a quite well-known fact, that when people have a major facial trauma, that they have their face which is totally destroyed, it's a hard thing to say, but it's somehow a new start in their life. They don't specifically want to go back to what they were before. First, we cannot reconstruct the face as it was before technically. It's impossible to have exactly a reproduction of what the face was before, but it's not always even the goal of the patient. The goal of the patient is to become normal again, to be unseen in the crowd when he walks around, but he doesn't want to become exactly what he was before. And this points to the fact that maybe the whole of the memory is not located in the face. And in Gideon's work, you see that the body expresses a lot as well, not only the face. There's a lot of information and expressions in the body of his faceless individuals. And I'm going to make because you mentioned the word remembrance of times past. I'm going to make quite a pretentious quote, but I think it's interesting. There is a quote by Walter Benjamin when he was talking about Proust, who was saying that the face carries all the memories of life, the sorrows, the happiness, with the wrinkles, with the expressions that leave signs. But most of the time, we don't really feel the big moments of our life. And the master of this, he writes the fact that the master of the house is often away. So we are quite distant from our physical appearance. And this is an experience that probably many people had, especially when you reach your 40th year of age and you become a bit older, little by little. You walk in your house and there's a mirror and suddenly you see someone on a glimpse that looks half like your father and half like a distant uncle on your mother's side, and you say, who is this guy? And it's you. So you have a distance with your own appearance, and probably all this together makes the fact that people who have lost part of their what they were considering as their individuality before the accident want to rebuild something that's not exactly what they were before. And this is quite striking in those face transplants. I can show you another example here. The first one was the one that was performed in France, and this is the second one that was performed in the US in Boston. On the left-hand side, you see the patient before the accident. In the middle, it's quite a hard picture. It's the patient with what traditional maxillofacial surgery can do at its best now. So this is what we can reach at best for the reconstruction of the patient. Obviously, you don't see how severe the accident was, but it was a very severe accident. And on the left-hand side, it's the result of the facial transplant. So she has the face of someone else now. And yeah, the question is, obviously, it's not the same person, but you know, her individuality and her personality has to be rebuilt with this new face. And it raises questions that are quite different than what we would, that our intuition would lead us to ask.
I think, Gidi, you had this quite interesting question when we were talking with Hossein as well. Hossein, yeah, maybe you ask it, yeah.
In a way, I'm just feeling like I can hear Hussein, and I'm like, I feel like I'm in a sandbox of kids, you know. I'm like moving sand and doing things with faces, and this is crucial. I mean, what you're talking about is actually, so I'm a little overwhelmed by that, I think. But in some way, for me, it's, although you described it quite well, how technical it is, but for me, I was very interested in those images, in the process of how does one start even, obviously I have no intimate knowledge of this, of how does someone begin even to find this new life, because this new life, it's almost like we know what happened before, but we cannot rely on it. It has to have a new life that has to answer to the new rules of this person, which I imagine everything inside is also have changed because of this trauma. So I'm very interested in this process. If you can say a little bit or explain a little bit about that. I mean, is it mostly how to solve the problem on the spot? I mean, obviously it's a great trauma, or is there any research done except the what you said? So for example, with the jaws and everything. So it's the statistics. What do you go to when you need to do that? I mean, obviously it's your experience and everything, but I'm actually interested in that process a little bit.
No, there are a few answers to this question. First, we need to restore the function. This is the first basic. People have to be able to eat, to see, to drink, to talk. And then we do what the patient wants. I mean, if we do the restoration of the function with some, I would say, satisfactory basic facial shape. And then we go as far as the patient asks us to go to. Sometimes there are tiny details that he wants to change year after year. And then at some point we have to decide together that we have to stop the reconstruction.
Would they sometimes go back to a photograph and say, you know, I want a certain this or that? I know it's very difficult for them probably.
This is quite uncommon, in fact. And as you said, when you have a big trauma, I'm not saying it in a positive way, the fact that you start a new life. It can also be understood in a negative way.
Of course.
But you just, first you have the memory of the trauma that leads you to probably, you know, to have a personal reconstruction of like a psychological reconstruction. But also it's a new start in many things. You have to change your lifestyle, you have to change your relationship with others, with your family. So it's really hard to realize when it hasn't happened to you, and it hasn't happened to me either, but I've seen many patients who really see it as a break point in their life, and there is no really will. There's no really will to go back to what was before. And the other thing that your question makes me think about is when I see your paintings, like the two ones that are behind us, is that the memory and the personality is of course it's a lot located in the face, but you can based on the global attitude of the person. I'm sure everyone. If you ask people in this audience to guess what the face of this man would be, I'm sure results would be globally similar. I think you go towards a certain facial appearance based on the gait and the attitude,
the stance and the mannerism.
Yeah. And basically, this is also what we do in our work. It's based on the same principles. It's that we have to guess, you know, what it was and what the patient wants based on the way he is globally.
Now I'm trying to imagine a patient and then with a new life, but observed from the back. Would they have the same mannerism? I imagine so, or maybe not. The same stand or this, or does that you think changes as well?
No, I
think it probably changes.
Yeah,
no?
It changes also, unfortunately, based on the traumatic experience.
Of course, if there's a physical, of course.
It also depends a lot on what the trauma is. For instance, a wounded person in an attack has a very different personal story than someone who, you know, because he's a victim, than someone, for instance, who survives from a suicide attempt. Yes. Those are totally different personal stories, and they have different ways to cope with their reconstruction, also with the process, and even in their demands, they're quite different. If you take one of the most documented stories about facial reconstruction is this great book that came out 3 years ago, Le Lambeau, by one of the victims of the Charlie Hebdo attack. And he described step by step what was his, in parallel, what was his psychological and his physical reconstruction process. And as of course he was attacked and he was obviously a victim. So it's totally different what his process than someone who who, for instance, is in the process of self-destruction, or someone who had a terrible cancer and who has to go through reconstruction after a surgery. So all those are, but globally there is very little, I would say, demand to restore things as they were before, because the traumatism of the disease, of the accident is a major event in their life, is a breakpoint in their lives. Yeah.
Hossein, you were mentioning right now this book Le Lambeau, which I read which I read as well, and it's also a lot about like the personal implication of the medical team around this person who had these facial features deleted through the Charlie Hebdo attack. So could you tell us how, as a maxillofacial surgeon, how is the personal implication when you have to deal with this kind of patient? Is there one moment you just need to shut, so you don't get touched too much? How do you deal? And actually also, Gideon, afterwards I want to ask you as well, what is your personal implication as well when you paint, for example? I would be really interested in that as well. First, Hossein, maybe you?
Yeah, this is a difficult question. We have, according to the Hippocratic Oath, we don't, as doctors, we don't have personal relationships with our patients that lead to different treatments. We do the same. So the basis of our work is to provide the same kind of care to everyone. It could be a violent, like a white supremacist, or a prominent university teacher. We need to do exactly the same kind of care and do the same efforts. So it's quite difficult to and of course we are all human, so we have personal relationship with all the patients. In the field of facial reconstruction, as we have a lot of personal input in our work, it's a bit different from abdominal surgery, for instance, where everything happens inside and there is no sign of what we did outside. This leaves a clear sign of our own personal input on the face of the patient. So obviously we need to establish a more built relationship with the patients to answer, even if the question is only to answer their needs. We have in our relationship with the patients to build something a bit more personal than other specialties. But still, it remains personal only for professional reasons.
So I was wondering, when the person is healed again, how do you feel when you say goodbye to this person? Do you feel empty, or you miss him, or what is the feeling afterwards?
No, when it's in surgery we have successes, of course, and we also have failures. That's part of the work. So obviously we feel it very personally, but we keep it at the level of personal achievement and the professional achievement and personal achievements. That's the main thing, and we are happy to have done our work well and to have made the patient, to have given him a new life. But the whole point is to keep it away from as little personal involvement as we can, but still we need to interact a bit more than other specialties to understand some specific needs. And I work with kids, so it's even more different. I need to interaction with kids is interaction with three people. It's the parents and the kid. So I need to establish this relationship of like four people talking together. Obviously the kid is at the center. He has to express, or she has to express what she wants or he wants, but the parents are also here. So it's even more intricate and complicated, and you have to find this difficult balance between personal involvement, personal feelings, because sometimes you're sad, sometimes you're happy, sometimes you're not in a good mood and you don't want to see the patients, and it depends on the days. And also your professional goals and your oath that imposes you to provide the same quality of care to every patient.
Gideon, I was also asking you the question, what is your personal implication, and how do you feel actually when you say goodbye to one of your paintings, or when you erase a face?
Like a good kid, you want him to go and not come back, and don't embarrass me in a way like that, I'm just thinking of the process, of my process, and in a way, an often thought is some people get scared from the faceless. I think as people we like to focus on our differences, we constantly, in the news, in politics, we constantly focus on our differences. While actually, I don't know, you probably know the numbers, we're so much alike. And in somehow, when I think of Hossein's process, it's almost like trying to take something from a disaster, from a trauma, and bring it back to society, to take part and almost melt within society. And I really am kind of, that's what I'm now thinking of. And in a way, how by when I kind of make, it's almost like I prepare it for a face almost, you know. Yeah. And I prepare it for a face, but for me as a viewer, for you as a viewer, for us as viewers. So that's the thought I'm actually left with, which is quite, which I find quite interesting, because how really you build a face which really has to activate this new persona and have, you know, let it play within this kind of social, you know, way we live in. So it opens many questions for me, but I don't know if it answered your question. But
well, I think it's also the answer is actually each spectator as well who has to give the answer in the end, because that's what you do actually. You also, as you said, like you prepare something and then it's up to everybody to interpret what they see as well, and what's their projection of their inner world or whatever, of their thoughts. So,
I think it's a richer experience when we come to art, obviously, when it involves us, whatever makes us, when it meets us halfway, and we come with our own. I think we can argue that the value of art is how much it touches us, you know, and it's not true only for painting, it's true to music, it's true to film, it's true to a book we read, and it could be from somewhere it was really have nothing in common with us, but we feel, we know the life, we understand it, and how does he know me, how does she know me? And I find this very interesting for me, these common things, that I also find how Hossein in his work, in his line of work, striving for that, and I can just only imagine the importance of it to a life of a child and all that.
Actually, Hossein, you were asking this very, I think, very interesting question as well, because we're talking about faceless, where people are faceless, but is there any other place where memory can lodge? I'm asking this to the both of you. Where can memory lodge apart from the face?
Well, when you look at Gideon's painting, you see that the whole body expresses a lot, but there is obviously the face is a great source of signal, social signal. There is a famous short novel by Marcel Schwab about this woman who is facing two patients who have been wounded during the First World War, and none of them has any recognizable facial features left, and one of them is her husband. So she doesn't, it's a very short novel, and at the end she still doesn't know which one her husband is her husband, and she has to choose which one she has to bring home after from the hospital. So then there is no, in those two patients, of course it's a novel, but there is no recognizable sign left that would even lead the wife to recognize the husband. But of course there are many other places of memory. There is the hand, obviously, which has a lot of personal memories, and there is this famous fact in medicine, especially in people who do grafts. We know that some people lose their hands in accidents, like in work accidents when they are handling dangerous machines, and there is a process where you can graft the hand of someone else, as you can do with the faces. You can graft the hand of someone who is an organ donor to someone who has lost his hands. And there have been a few cases where the patients have not been able to stand the fact that they have other people's hands. So they have even asked to remove the grafts. And they would be better without those functional hands, rather than with the hands of someone else that they would see touching their own body. So probably this...
Such a value of personality for the hands as well, not only the face in a way.
Well, actually, it brings us to the title of your exhibition, which is A Stranger's Hand. The hand is a very important tool for both of you, because you both are doing, in a way, the work of craftsmen. So Gideon and Hossein, well, maybe there's actually, there was one thing I wanted to mention, maybe for people as well, that the word surgery comes actually, the etymological origin of surgery means made by hand, hand labor. So, which brings it even closer to this reference of craftsmanship. So, well, for you both, the hand is a very important tool, and I would like to know, what is the most common or frequent gesture for you both in your work to erase something or to reconstruct something? Is there a gesture, a typical gesture that you do?
I mean, for me, it's of course it's the brush. It's the brush that it's like a scalpel. I mean, it's the extension of the hand, and of course everything included in it, the handle, the hairs, of it and stuff. So I imagine it's just that. It's kind of the mixing of it and then going and doing that, which is very, very direct. And yeah, I'm just thinking of this stranger hand and the fact that becomes part of the language that allows within the painting. And the fact that even now today, the concept of a stranger's hand, and even you don't even shake the hands of the people you know. So also maybe stranger hand is not that strange. I mean, because I don't know.
No, in surgery, it's a matter of learning from the master. So you have to. There is a set of gestures that we have to know for each specialty. It's a finite set of gestures, obviously, but there are a few complicated knots and the use of complicated tools that we have to learn, and we learn it by first seeing other people do it, and then we do it under their close supervision, and then after a few years of practice we become independent. So there is a quite close links with craftsmanship, where you go through a process of seeing and then doing under supervision and then doing by yourself. And the other part of surgery, I shouldn't be saying this, but the surgeons are like little kids with new toys. So we have lots of also innovations and new devices, and this is also part of the excitement of the job, is to have new instruments and to experiment new technological devices. Of course, to improve the care of the patients, but also it brings quite lots of satisfaction to us.
A little bit of fun.
A little bit of fun, yeah. But the point is to master the instruments to do the more you can to the tissues and to the structure of the patient with the less harm. This is the whole balance, because obviously a surgical procedure is an aggression to the body. You open up the body and you aggress the tissues, you put screws, you cut the bone, you cut the tissues. So this is very aggressive. And the whole point of the process is to be as gentle as possible and at the same time do the required transformations of the tissues that will lead to the result that you want.
So I'm listening to this and I see Soutine, the carcasses of Soutine. I see Rembrandt when he paints the operation.
Yeah.
Yes,
I just,
true.
he's talking and I see art history.
Yeah, nice. Unfortunately, we can't read your mind or project it somewhere.
The relationship of artists with their work can be quite aggressive sometimes as well, but you need to find the balance between the aggression and the
No, it's also the tool of operating, of activating your hand with the instrument on a body, on a literal body, and paint, one of the best qualities of oil paint, that it can be other things. I think that's part of the fascination that I know that I, in this age, feel with it, because it still can describe things pretty interesting way. So I'm just thinking of the kind of the physical oven operation in this, and I just see the operations of art history.
The other thing we have in surgery is that what we do is the result of history. So, for instance, we reproduce gestures that have been developed by masters that sometimes the procedures date back from the 17th century, 18th century, and the gestures have been transmitted from generation to the other two generations, and they have been, of course, transformed and adapted. But it's every
basics
gesture, every basic is the result of a history of the development of surgery, and obviously there are some similarities with craftsmanship and art in the way you develop a technique and a movement over the years and over the generations.
Actually, you both are talking about the big masters. Gidi, you were mentioning Rembrandt, and Hossein, you're talking about the old masters or techniques from the 17th century. There was actually Michelangelo saying, penso con il mane, I think with my hands. So would you agree to that?
100% as a painter, I think it's the way for me. It's a much richer way of me thinking. I think I understand things like I cannot understand in any other way. It's not only that, it's my way of communicating. So I would totally agree with that.
Well, people communicate a lot with their hands as well, but in your case, it's even
But
more
it's,
than that.
It's
yeah.
more than that. It's a very tactile experience.
Yeah. And you, Hossein?
Yeah, there is an interesting cognitive science experiment. The same works for professional dancers and for musicians. If you take young surgeons and you show them a surgical procedure and you make, at the same time, we record their brain activity using functional MRI, it activates the areas only of vision. So they're just seeing something. But if you take older surgeons, it activates the areas of movement. So they're reproducing the movements in their brain. When they see, because they have tried to do it themselves, it starts to be encoded into the areas of movement. So they see it as they simulate the movements in their brain. And the same works for pianists and for dancers.
For a painter, same thing.
Painter as well. So
it becomes almost subconscious. It's part of you, the movement of the hand.
Exactly. So
it's as you as it's your being somehow, I think.
And we have to, as surgeons, we have to encode the basic procedures of our field and then adapt them to every case every time we are doing a new procedure. But the vocabulary, the basic vocabulary is quite common it's quite common to different surgical fields. You know, because we deal with the same body, with the human body, which has rules, and some things work, some things don't work. You know, there are some blood vessels at the same place, and some muscles you can cut, some muscles you cannot cut. Nerves are at the same place. So there is a vocabulary of movements that we have to learn, and then we adapt it little to every specific case that's always a bit different.
It's really like a craftsman of the body, as they said before, yeah. So, well, I would like to invite you now. Maybe you have questions that you'd like to ask Gideon or Hossein.
But you don't have to.
I was curious to know, Gideon, if in your process of painting you first draw or paint the faces and then paint on it.
Before it initially, and also exactly what we said, that yes, it was in order to get the right structure, in order to get this, and then there will be some kind of erasure. But I think now it's so internal that I'm able to build it in a certain way from the beginning, going through the motions that I know very well. But then often it comes, I insert it again because it has to have some hook. It's missing something, and it has to be. It has to have an intervention in order to build it. It has to work as a form. It has to have a life again, you know. I mean, sometimes I look at other people. I'm not the only one who paints faceless people, and I would look at, oh, it's faceless, you know. But I don't feel like that with mine. So I think it's partly yes, and sometimes I do that more. But it is important for me. I mean, I draw when I start painting. I still. It's very natural for me drawing, so I draw first everything, and everything has to and put in, and with the drawing you do use that, and then it's erased.
Yes, Hossein, I would like to know, what do you feel or think when you see those paintings without faces? Are you reconstructing in your mind? Do you have your creativity running when you see those faces missing their subjectivity?
I think I see them as many other people see them. Their gait and their gesture expresses so much that I don't really reconstruct the face in my I would say as a mental image. You see them as full individuals, even without their faces. That's very surprising, and that's probably why it's not. They don't give out any feeling of. It's not gloomy. It's not frightening. The whole feeling when you see those paintings is quite soft and even welcoming. And I mean, that's my own feeling, and I don't see them as something disturbing or aggressive. So I see them as nearly fully formed individuals. So yeah, surprisingly, I didn't even build any mental image of reconstructed faces. Even though, yeah, there is a nice novel by Ismail Kadare called I don't know in English, but it's a guy who is in charge of digging out war victims in a war zone, and he digs out heads and he has to identify them. And it turns out that after some years, he cannot prevent himself from guessing how the skull is when he sees people. So it's the other way around. And sometimes, as maxillofacial surgeons, I think more like this than what you refer to. When I see people, I think more about their craniofacial structure inside than the other way around. So that's more what happens in my mind when I see faces. But with those faces, surprisingly, you don't feel the need to make any reconstruction of those faces. I couldn't explain why, but they seem quite happy and good like this.
It's a common field for you, for both of you.
It's for me, it's just a pleasure to see just a little bit of where we can meet. I mean, again, you know what he does. I'm not, you know, just an artist painting paintings, but it's just nice to have a little a point where it meets. And for me, it was quite interesting. So I actually hope that if it was for me a little bit interesting, and I was very interested to hear what he says, I hope it was for you as well. I think it's good. Thank you very much to Hossein, and thank you to Anahita, and thank you to Galerie Karsten Greve.
Thank you very much.